the notion that New York handled this right and everybody else handled this wrong is totally crazy. It is also true that one of the reasons that you're seeing that gap emerge between number of cases and number of deaths is because a huge percentage of the people who are testing positive are now under the age of 35. And as we know, if you're under the age of 25, particularly, this is not a deadly disease. Okay, meaning it can kill you, but it's less deadly than the flu if you're under age 25 by statistics. So here's Mike Pence, the vice president, pointing out, guys, yeah, we're seeing a spike, but that's basically a bunch of young people socializing.
There's another way, John, that this is different from early on, and that is that one of the things that we've heard in Texas and Florida in particular is that nearly half of those who are testing positive are Americans under the age of 35. That's contributing to the fact that those that are requiring to be hospitalized who are testing positive for coronavirus is significantly lower than it was 2 months ago.
Okay, so he is right about this. Ron DeSantis said the same thing. He said 20% of the tests are for those who are 25 to 34 are positive. So basically a bunch of people are going to bars and they're getting it and they're young. And so we're not seeing a lot of those people hospitalized, who was Governor DeSantis yesterday, who, again, is the bad guy here. Remember, he's the villain. Andrew Cuomo's the good guy in the media narrative here. He's the black hat, Ron DeSantis.
You still see the numbers in those younger age groups compared to the number of positive tests, very, very, very low fatality rates. And so you're seeing it in those groups who are less at risk, but you're seeing them test positive at much higher rates. I think 25 to 34 has been pretty close to 20%. And we're seeing it all across in the different areas of the state. This is the one kind of consistent thing.
By the way, it's also happening in other states. So if you look at the share of new Minnesota COVID cases by age, you've seen a huge, enormous spike for people who are 20 to 29. I'm looking at a chart right now that shows those Minnesota COVID cases by age. You can see it has declined in every single demographic group, except for people who are 20 to 29. And most importantly, it's declined for people who are 60 to 69 and 70 and above. Right? The people at the very bottom of that chart are the people who are most likely to die from this thing. So it's really, really spiking among people who are 20 to 29. Notice that spike begins right around the beginning of June, right around June 15th or so, which would have been exactly 2 weeks after the beginning of these protests. But the protests didn't do anything, apparently. So a lot of young people are getting this thing. Now, again, could that be dangerous? Yeah, sure, it could be dangerous. It could also be dangerous that in border counties, there's immigration across the border, something Phil Kerpen has pointed out. Phil Kerpen points out that if you look at the charts in areas of with different border populations, the positivity rate in Mexico on these tests right now, the positivity rates in Mexico on COVID-19 tests is nearly 50%. It's like 48%, which means a lot of people in Mexico have it. He points out that cases per 100,000 residents, high population non-border counties like Maricopa County or LA County or Santa Clara County, they're not having tons of cases per 100,000 residents. But places like Yuma or Santa Cruz or Imperial are having a lot of cases. So there are a bunch of different factors. But until the system is in danger of being overwhelmed, this is not the same thing as it was before. The media basically been saying we're back to square one. All of the hard work was blown because of all these evil red governors who release people. And some things have changed. Again, the people who are getting infected, by and large, are people who are younger, which means that it is less dangerous. And you're basically getting the controlled avalanche strategy that I actually kind of talked about months ago, right? You're effectively getting the controlled avalanche strategy that says, if you are elderly, then avoid this thing. And if you're younger and you get it, then okay, all right. I mean, like, not great. Some people are going to be ill affected by it, obviously. And there are going to be more people in hospitals, and you are seeing increased hospitalizations. But the rate of people who are dying in hospitals is going down fairly dramatically as well. And this is true, by the way, across the world. I mean, this is a news story that has not been reported very much. But late last week, it was reported by the science editor at the UK Telegraph that according to an Oxford study, hospital patients are now 4 times less likely to die than they were in April, because there are a bunch of different drugs that are being used that actually mitigate the impact, and doctors are becoming better at treating patients. It used to be they were sticking everybody on a ventilator. It turns out that is one of the worst things that you can do. So hospitals are getting better at treating patients. More of the people who are getting this are young. Does this mean that you should go out willy-nilly without a mask? No, it doesn't, because again, as you spread it, there are 2 risks. 1, you pass it on to somebody who's older who can't handle it. And 2, that you overwhelm the hospital system. But the notion that we are exactly back where we were, and that we were back where we were because of red state policy, is utterly crazy. And by the way, the red states are actually being pretty cautious about this. Right? Texas, last week, shut down all the bars again. Hey, then California, 2 days later, shut down all the bars. And it was like, well, look at Gavin Newsom. He's responsible, as opposed to that horrible Greg Abbott. It's like, well, no, that's not how any of this works. That's not how any of this works. It is also worth noting that when I suggest that this thing is less dangerous for people who are young, That is not just me saying this. This is the American Academy of Pediatrics. The American Academy of Pediatrics is openly saying at this point that all the schools should basically be reopened at this point. They put out a full statement suggesting that kids should be in schools. They say school policies must be flexible and nimble in responding to new information. Administrators must be willing to refine approaches when specific policies are not working. But no child or adolescent should be excluded from school unless required in order to adhere to a local public health mandate or because of unique medical needs. They say we strongly advocate that all policy considerations for the coming school year should start with the goal of having students physically present in school. That's the American Academy of Pediatrics. It's not radical right-wingers who are making that particular claim. So concerned but not crazy would be the answer here. Concerned but not out of your mind with worry would be the answer here. Cautiously, maybe even at this point, if you're talking about that, again, disparity between deaths and hospitalizations, maybe cautiously optimistic that this thing is starting to peter out a little bit. That doesn't mean